Before we dig into the news of the day, we do want to warn you about this. Today's content contains some pretty heavy stuff. Experts say the mental health of our children has really suffered over the past 2 years. So you're going to be hearing from doctors and from kids about a lot of difficult topics like depression and suicide. It can be hard to hear, but it is a conversation that we need to keep having. And we want parents to know where they can get their children help. And we want to continue shining a light on something that really needs attention. Doctors say we are experiencing what's called a mental health crisis. The American Academy of Pediatrics even declared a child mental health state of emergency. A CDC study found people 12 to 17 went to the emergency room for suspected suicide attempts 31% more often since the pandemic started. A University of Michigan poll asked parents what they saw in their kids. Nearly half said their children had developed new or worsening mental health symptoms. Now, doctors say they're seeing more instances of mental health emergencies popping up, and it's not always somewhere that they expect.
We've had 4 kids that I know of personally that came in for completely unrelated problems, so a broken arm or an earache or whatever it was, and actually were acutely suicidal to the point where we needed to transfer them to inpatient facility right then and there.
She says children going to the ER with mental health emergencies is part of the issue. She thinks they need other care options as well.
That there's something wrong with our system. The emergency room should not be the place to go and get, acute mental health care when you're in a crisis. We are not a nice, calm environment.
The pandemic certainly made the problem worse. Doctors say the issues will linger even when it goes away.
We're coming out of the pandemic, but kids have still lost 2 years. 2 years of socialization, 2 years of education, 2 years of their world kind of being shaken up. So as we get quote unquote back to normal, I think kids are struggling. Even when the pandemic's over, this crisis isn't going to be over.
Well, the issue definitely has the attention of Congress. Teenagers struggling with mental health and doctors testified before Congress to share how dire the situation has become. One teenager discussed his struggles. He says he's grateful that he got help. Some of his friends didn't have the opportunity.
My friends have struggled to receive professional mental health services because it's too expensive for their families, too far away, or inaccessible because of unreliable internet access.
The stories from the emergency room really illustrate how serious things have become. A doctor says she's treated children as young as 5.
A 6-year-old boy suspended from 1st grade for kicking a desk after witnessing a shooting 20 feet away from him while walking home from school, too terrified to disclose the experience for fear that he would be the next victim. A 16-year-old honors student becoming depressed after a romantic breakup, eventually making a serious suicide attempt while waiting 6 weeks for treatment.
Well, some of the country's top mental health nonprofits partnered up to assess where the states rank on kids' mental health and how schools are handling it. The Hopeful Futures campaign says North Carolina has fallen behind in recent years. In 2015, the group Student placed our state at 30th for overall state rank for youth mental health. We're now ranked 42nd this year. The report says access to care for kids is one of our biggest weaknesses. The experts with the group recommend schools have 1 psychologist available for every 500 students, but the study found North Carolina has 1 for every 2,500 students. It also says more than half of students in our state who have experienced a major depressive episode did not receive treatment. Now, mental health professionals say there usually aren't huge red flags that your child is in trouble. Instead, they say you really should be looking for these subtle changes in their behavior over time. The Mayo Clinic says look for things like changes in sleeping or eating patterns. It also says pay attention to differences in their moods or school performance. Here's another good example. A mom realized her child was struggling when she saw him draw himself wearing a mask, looking down and sad. It just felt kind of off to her. So she asked her son, and he said all the parent arguments about kids wearing masks has really worn him down.
I said, it says a lot to me, Tyler. I didn't know you were this stressed and this sad about it, and about the arguments and the fears.
She made it a goal to check in with him more after that, and a triad psychologist says that is something that all parents should do, and often.
Be careful about the way you say, oh, what do you have to be stressed about? You're a child. They have things to be stressed about. Acknowledge their stress. Don't invalidate it. That is even more stressful when someone invalidates their stress.
The director of psychology at a children's hospital says those talks can't just happen once or twice. She says you have to keep doing it over and over and over again.
It's pretty simple. So at dinner, whenever there's an opportunity, how are you doing? And with kids, check-ins really look more like play and special time. With teenagers, it's more just asking repeatedly and often and being persistent and not taking that first sign of resistance as a sign that you shouldn't be asking, right? Kids need to know that you're predictably, reliably there for them.
The doctor also encourages parents to talk about their own feelings in front of their kids. It's good for children to see how you deal with your problems. Well, a program at Northwest Guilford High School has tried taking a proactive approach with all this. Teens Gotta Talk is what it's called, and it launched at the school in the wintertime. It's a 12-week program designed to address mental health issues specific to teenagers. One student says the program helped her a lot.
But I think it really allows students to really open up about their mental health, especially since, you know, with COVID, we were really isolated. And so having that open discussion really brought attention to how our mental health changes, especially in our teenage years and going into adult years.
Well, the program works so well at Northwest, Teens Gotta Talk wants to expand to other schools in the district. It is important for parents to know that there is help out there for their child. You can help get them the support that they need. The national helpline is 1-800-273-TALK. You can find the National Crisis Text line by texting HOME to 741741. And then the Trevor Project specializes in providing mental health resources to people under 25 who identify as part of the LGBTQ community. And you can reach them by texting the word START to the number 678-678. Now, I know there was a whole lot of numbers there, right? So what we're going to do is we're going to continue to keep the discussions open here on WFMY News 2. And if you ever feel like things are getting too hard and you're struggling, we want to make sure that you have those resources to share. So we're going to put them up again. We want you to take a picture of them with your phone.